You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
So, you think you have skeletons in your closet? Come to Sternberg Museum, where we let our skeletons out of the closet.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of the West Central Kansas Smart Start program. And with me today is Elaine Wrap. Hello, Elaine.
Hello, Dana.
Now, first of all, Elaine, tell us where you work and what do you do there?
Well, I work at the Hayes Area Children's Center, and I'm with the Healthy Start program from Ellis County.
Now, you get to see moms and families in their homes, correct?
That's correct. I see them prenatally and postnatally.
Okay. Now, today we're going to talk about a very important topic for all women, and that is preconception health, which affects mothers and babies. And first of all, I guess, what is preconception health?
Well, it's really the health of a woman before she becomes pregnant, and it's sort of for women to understand and to know what health conditions or risk factors could put their pregnancy in jeopardy or create some problems. And so it's sort of like planned care. It's sort of like an insurance policy to make sure that your baby is born healthy. And so like every woman, we should be thinking about our health, obviously, and especially if we're going to consider becoming pregnant. And that means taking a look at ourselves, maybe chronic health conditions that we have, maybe behaviors that we have. And then we want to sort of think about these so that we can develop a plan so that we'll have a healthy pregnancy. And this is really important because half of all pregnancies are unplanned. And women who are sexually active really should be considering their present health and their behaviors now before they become pregnant to avoid risks that could impact their developing fetus.
Now, if I were planning on becoming pregnant, and I'm not, but what if someone is out there, they're thinking about, well, maybe I'd like to have a baby, you know, they're planning that. What would be the most important things for that woman to be thinking about?
Well, the first thing that comes to mind is that we should be taking a multiple vitamin every day, something that contains 400 to 800 micrograms of folic acid, because that's very important for baby's neurological development, his spine and brain. And then we want to think about, are we a healthy weight? You know, do we have any chronic conditions that we need to take care of, like perhaps diabetes or asthma? And then also, if we are a smoker, we would want to consider quit smoking. Obviously, alcohol is something that we should quit as well because that's not healthy. It's dangerous during pregnancy. And then also on an emotional level, I'm going to add that women should think about where they're at in their relationship. A stable relationship that's committed is very helpful to reduce stress.
Now, how soon should women start thinking about preconception health? A month before the baby, 6 months, a year? How long?
Well, you know, this is a conversation that mothers should even be having with their daughters because we want to start thinking of preconception health before a woman or a girl becomes ever sexually active. So if you're planning to become pregnant, usually about 3 months in advance, and visiting with your doctor, again, going in and maybe covering topics about health conditions and drugs that you're taking, prescriptions, over-the-counter, things like that. Now, if you're dealing with more specific problems like perhaps weight or smoking and things, this may take longer, so you might be looking at a year before you conceive that you should be thinking about preconception health.
Now, I know you mentioned something about, not drinking during pregnancy, and we all know that's very bad. But I know I used to hear people say things like, well, a glass of wine a day won't hurt you when you're pregnant, and it might actually help. Is that true?
Well, Not anymore, because we have better studies. We've shown conclusively that low levels of alcohol can significantly negatively impact a fetus's development. So we know now, and we really impart that message to all women, there's no safe amount, no safe time, and no safe kind of alcohol, because some women think, oh, it's just a beer, it's just a glass of wine, it's just a wine cooler. But all of those things can impact a developing fetus because they all are alcoholic. So even before a woman becomes pregnant and is aware of it, and sometimes that's 6 to 8 weeks before she's aware that she's pregnant, those types of behaviors can significantly impact the neurological development of a fetus. And we're talking about the brain in particular, as well as other body features, the facial features, key organs are developing at that time. But what's significant about the neurological system is it's developing from the point of conception through the whole 9 months, so damage can occur. And this is because alcohol passes through the placenta barrier. The placenta holds out a lot of bad things, but alcohol is not one of those things. And so when a mother drinks, it's passing through, but unfortunately the baby can't metabolize that alcohol as well as the mother can. So it stays at a higher level for a longer amount of time, so it's significantly more dangerous to the infant. And 30 years ago, they gave a name for these types of disabilities and defects that we see, and that was fetal alcohol spectrum disorders, with fetal alcohol syndrome being the most significant or the most severe. Excuse me. And there are about 60 types of different defects and deficits under this spectrum of disorders.
Now, I'm going to interrupt you. I know you brought some visuals, so tell us a little bit about these.
Well, this gives you a good conception of what happens, because there's invisible and visible things that can happen. And so particularly when we're talking about the neurological system and the brain can be impacted, again, from conception through the whole 9 months. So this just illustrates here what a healthy baby's brain as compared to a baby's brain that's been affected by prenatal alcohol exposure. You'll see the significant difference in size, the structural difference, the corpus callosum, which is the membrane that connects the right and left hemisphere. In babies that mothers have had prenatal alcohol exposure, that's always significantly damaged. And so that's what helps, the brain talk back and forth. And then, of course, when we look at the outside of a baby, we have a baby model here that shows some of the deficits. And if you'd like to if you can pick the little baby up, we can see that there's significant differences in the facial features here. We have a flatter nose, a smooth philtrum, eyes that are set further apart, low setting ears. We have low muscular development in the arms and the extremities, spindly legs, and more depression in the sternum and the chest. And these are significant ones, but again, just because a baby looks not like this model does not mean that they haven't been impacted in more of an invisible way through the neurological system. So obviously this is why we really encourage mothers. Preconception care really means not drinking alcohol.
Now, what if you're pregnant and you just have alcohol can be an addiction? Where do you go? What do you do if you find out you're pregnant and you can't stop?
That's a good question. And we want to really remember that your doctor is your advocate. You want to be honest with your doctor. Go in, and the sooner that you seek a treatment plan, the better it's going to be as an outcome for yourself and your baby. And so with that said, we would think that perhaps mothers could find treatment plans within Hayes that would be available. Mothers can contact myself as well. But we have a nationwide campaign right now through for Alcohol Awareness Month, which is really trying to raise awareness for all women and individuals in the community, families, how important of a health and a social issue this is for everyone.
Now, Elaine, if someone wants to get more information on all this on this topic, or just wants to talk to someone about this, can they contact you?
They certainly can, and again, I'm available Monday through Friday at the Children's Center and Ask for Healthy Start, and please to contact their doctor, and they can also put them in touch with services that would provide some assistance in preventing fetal alcohol spectrum disorders.
Your telephone number.
It's 785-625-3257, and that again is at the Hayes Area Children's Center, and ask for Elaine with the Healthy Start program.
Elaine, thank you so much for the wonderful information. You've been watching You and Your Young Child. Parents, remember, you are your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History.